Thank you very much for your patience. I apologize. Like I said, I thought I was being on 12:30. So, the theme of the conference is never ever give up, and I know that we've all experienced folks in our business, in our daily lives, who have just had some amazing.
Primary care doctors with changes in healthcare and push to have shorter and very problem-focused visits. They miss about 30% of those entire session.
Alright, try again.
And you'll see why that's a significant problem. So, depression increases significantly.
Okay, well that helped. So, so when people talk about Parkinson's disease, I'm just going to give you a really quick encapsulation of what Parkinson's disease is. A lot of the picture that people have of Parkinson's disease is of the old Tim Conway character from Carol Burnett, stooped over with a really small gait, no arm swing, right? So this is what a lot of people see of Parkinson's disease. And the thing is that Parkinson's disease, like all the other neurological diseases, is much deeper than that. And the aspects of the disease that are beyond just the sheer outside movement part are the things that have the greatest effect on people, not just the person affected by the disease, but the people around them. And it's important to recognize this when you're working with clients that have Parkinson's disease and their family members to really kind of get a breadth of understanding what's going on. So this is like the old parable, what does an elephant look like to a blind man? You know, it all depends on where you're touching it. So when you look at the overall picture of Parkinson's disease, the picture starts long before the diagnosis. So we had folks that I would work with, and they would say, oh, you know, years ago I lost my sense of smell, or I started having some intestinal or some bowel problems. Well, if you look back retrospectively for people that have Parkinson's disease, when those things were starting to occur is actually kind of the onset of what later becomes Parkinson's disease. So then, you know, when you talk about the disease overall, people think of Parkinson's disease as a 20 to 30-year progression, which it is for most people. But these earlier symptoms can happen long before the initial diagnosis. And then people have sleep changes, and those sleep changes continue to get increasingly more difficult as time goes on with people with Parkinson's. You know, and then you've got the initial symptoms that people recognize as Parkinson's, and there's a clinical diagnosis. There's not really a way you can diagnose someone, you know, from a physical, you know, there's no test you can do to a living person to see if they have Parkinson's disease. It's all done by a clinical analysis from a physician. And so, you know, they're evaluated for those initial symptoms, and then, you know, you go into the problems with balance in medicines. And there are a lot of people that are misdiagnosed. A lot of people that present to their primary care doctor or to a local neurologist with certain symptoms that may look like Parkinson's disease, but really are not. And so it's important to really parse those things out from a treatment perspective to make sure that you're being the most effective you can. So then, you know, then we get into the problems with the more difficult walking and the dementia. So when you look at the initial physical symptoms of the disease, a lot of people have a much reduced arm swing, where they can walk and their arms will not swing at all. And you don't really think about that. You don't really think about how animated you are when you walk until, you know, you recognize that it's very unusual looking for people with no arm swing. Some people complain of shoulder pain, and they have changes in handwriting that continues to the disease too. So the thing about the handwriting thing is people with Parkinson's disease have an aspect called micrographia, meaning that as the disease progresses, their handwriting gets smaller and smaller and smaller. Just like everything else in the progression of this disease. Their movements get smaller, their voice gets smaller, their handwriting gets smaller. And it's those kind of things that people are working to combat through what they're able to do. So people most recognize Parkinson's disease because of the tremor. You know, people develop a unilateral tremor, one side of the body tremor, right? Or they have bradykinesia. Bradykinesia just means slow. It literally means slow movement. Anything in the medical field that says brady is slow. Anything with kinesia has to do with movement. So it's just slower movements. And a lot of people have stiffness and rigidity. That it's just part of the disease. So one of the biggest things in the news in the past couple of days is this whole aspect of depression in Parkinson's disease. Anyone that has heard that I guess she just announced it today. I was actually sitting in WEHT's studio between my interviews today when I heard that that Robin Williams' wife announced that he had the early stages of Parkinson's disease. Well, throughout the progression of all neurological diseases, there are aspects of mood. And when you talk about neurological diseases, you say, oh, well, they're still, cognitively, they're still intact, or pretty much intact, which happens a lot. But there are certain things that happen that are really hard to articulate, really hard to put your finger on. Where somebody with Parkinson's disease, for instance, there's a lady in Indianapolis that I've known for many, many years, and she's a talker. And when she was working and when she was out there in the community, she could carry on a really good conversation. But the problem is now that she has Parkinson's disease, she doesn't realize that her conversation lasts far too long. She doesn't pick up on the subtle kind of non-verbal cues. When you start packing up your stuff, or when you start to posture yourself a little bit, just to kind of indicate that the conversation might be going on a little too long. She doesn't pick up on those cues. Things that we take for granted, like every night when I wake up in the middle of the night and walk into the kitchen completely in the dark to get a drink of water, or I walk to the restroom in the middle of the night without having to turn on lights. That is huge. And you don't realize how significant that is until you work with a lot of people that have neurological diseases. And any barrier creates a huge barrier for them. So just the aspect of being able to wake up at night and be able to clear my head a little bit, and the ability to walk through the dark hallway is huge. But we don't think about that. It's just part of our daily experience. So it's important to recognize these things as part of these neurological diseases. It's just a piece of this that we don't really think of. And one of the things that happens in the sleep of somebody with Parkinson's disease is they have what they call REM behavior disorder. REM behavior disorder is acting out your dreams or doing things at night that you don't realize are happening. So we had a guy who literally would get up in the middle of the night and he would eat flour out of the flour bin. And the only way he knew that is because he woke up the next morning, there was a flour bin with a spoon and white powder all over his face. That's how he found out that he was having problems. One of the other issues that people have with Parkinson's disease is they have what's called orthostatic hypotension, which means the more vertical you get, the more your blood pressure drops. Right? So when does that cause problems? It causes problems whenever you're trying to get up, especially from laying down to standing up. Whew. Some of us might feel a little dizzy at times when we do that. Their blood pressure, people with Parkinson's disease can have their blood pressure drop to the point where they just collapse. Showers. When you shower or bathe, especially if it's warmer water, your blood pressure goes down. So if you're predisposed to your blood pressure going down, it's going to cause double the problems. So where's that causing an issue? Well, if you're having balance problems already, and you're in the shower, and your blood pressure drops, and you're just surrounded by porcelain and fiberglass, and metal fixtures, that's a really bad combination. So it's these kind of things that you need to recognize. Another thing that people have a problem with Parkinson's disease is their bowels don't move as well. So what happens when you have problems with your bowels not moving? Well, everything gets backed up. Your medicine doesn't get absorbed correctly. So one of the things I used to talk with my patients, I'd say, we want to make sure you're pooping and sleeping and hopefully not at the same time. Because it's important to keep those things going. Well, one of the things that you can do to help with that is to increase your intake of water, right? So then, if you have problems with urinary frequency or urinary urgency, another thing I used to tell my patients, they would complain, I got up twice last night to go to the bathroom. And I'm like, well, you know what? It's better to get up and go to the bathroom at night than to not get up and go to the bathroom at night. Because those are issues as well. So when you combine these things, so people who are having problems with urinary frequency, they got to go a lot. Or urinary urgency, when they have to go, they probably should have left a few minutes ago, right? If you're having urinary problems, what are you going to do? You're going to reduce your liquid intake, right? So what's that going to do? It's going to increase your problems with your bowels. So these things, they kind of build on each other, right? So when you're working with somebody as a case manager, or you're working in their home, and you see these things that are happening, it's really important to understand this is an issue. So when a lot of people have Parkinson's disease, another thing that happens is they start to lose some weight, right? Almost all neurological problems cause you to lose weight. So what do we think? Okay, from a nutritional standpoint, we're gonna boost up your calories, right? We're gonna do it using like these calorie, like Boost and Ensure, and we're gonna give you the high protein, high calorie ones, right? Well, for about 30% of people who have Parkinson's disease, if they get too much protein, their medicine doesn't work. Their body doesn't absorb their medicine. So when they wake up in the morning and they have that big glass of milk, and they have those bacon and eggs, and they take their medicine, and they're still like completely stiff and can't move, or they're tremoring like crazy and can't move, or they're frozen because they can't step, it's probably because of the great breakfast they had. You know, if they have coffee and donuts, they're not going to have that problem, right? So it's really critical to understand these things. And people talk about, as you get older, the risk of high blood pressure. That's one of the things that people are always on the lookout for. But if you are predisposed to having low blood pressure, and you're doing all these preventatives for high blood pressure, then that could be another issue, right? So from a home health perspective, from a case management perspective, all these things kind of build to this disease, and they create these issues with people who have Parkinson's disease. So one of the things, too, that's important to recognize is the mechanism that causes Parkinson's disease, or that is Parkinson's disease, has to do with the dopamine system in your body. That system that kind of, boom, gives you this burst of energy and happiness, right? Well, the dopamine system is misfiring. It's not creating it, it is creating it, it's not getting to the right place. So one of the things that happens as time goes on with this disease is people experience wearing off of their medications. So they start off and they get, one carbidopa levodopa every 5 hours, right? And everything's going fine. And then all of a sudden, at about hour 3, they start to crash, right? They start having this, what we call wearing off. And when they start to crash, then they take their medicine on time. So they've been crashing for an hour, and it takes them 2 hours to get back up to where they were, right? So they have a 3-hour window of non-function. And then they only have about 2 hours of good function, and then the medicine starts to wear off, and they need to take it again. So it's really critical to recognize these things from a clinical perspective, so that you can report and say, hey, are you having some wearing off? Or I noticed that things are starting to slow down about an hour before you take your meds. And then what they can do is they can get an increase in their medication. We had folks with Parkinson's disease that would have to wake up in the middle of the night to take their medicine because they had to have it every 2 hours. We had a lot of people and you guys might see these folks too, they wake up in the morning and they're still stiff and rigid, so they pop their medicine. If they need to pop it really quickly, they take one, they chew it up, and they drink Coke or Pepsi with it, because the acid, the carbonation helps to get it absorbed into the system easier. And then they lay down for another hour, and then they're good to go. Right? Or a lot of people who have Parkinson's disease have freezing. And if they're going down a hallway, or through a doorway, or going from a well-lit area to a dark area, if somebody with Parkinson's disease, if this is a doorway, and they're trying to get through, they might have, this freezing, where their body is just not moving. The body say, okay, let's go, but there's somebody that's So what do you do? Well, some people think you can just pull them, and that's not good, because then they just topple over. But there are ways that you can prompt someone. You put your hand, rest your hand on their back, and gently grab their hand, and just lead them in that direction. Or you put your foot in front of them, and have them step over your foot. Or you put duct tape down, and then you put consistently shorter pieces on each side. It makes it like a runway, and it's just continuously making fall. Or leave the lights consistent in the 2 rooms, so that they don't have that darkness or that extra brightness that they're moving into. So these are all little tips that I've just learned from working with people with Parkinson's disease. I've done this. I have been fortunate in my life to be able to know a lot of people with this disease, and it's just, they're just amazing people. So the first thing that when you're working with somebody with any neurological disease, it's important to remember is that people have their own feelings and their own ideas of their destiny. Some people want to have every possible thing done to them. Hook me up to every machine. You know, when you're talking about advanced directives, talking about end of life, what do you want? I want anything that's going to keep my body alive for as long as possible, right? But then you have the people on the opposite end that say, I just want to allow natural death. I want to just, you know, do the interventions, but I want to pass on in my own time. And it's important that when you're working with people, when you're setting up resources, that you understand these things. Because if you have someone that's going to want all of these things, all the medically possible things done, they're probably not a candidate for hospice and palliative care. Palliative care, yes, but not hospice care. So it's important to kind of parse these things out from folks as you're developing a relationship with them. Did you have a question, man? Okay. Okay, so let's talk about some critical periods where interventions at certain levels are going to be important. So we've got the initial receiving of the diagnosis, which is, as anyone can imagine, just huge. You know, and usually the first thing that people do, especially younger people do when they hear diagnosis, is they get on the internet. I want to find out as much wrong information as I can, so I'm getting on the internet, right? And they do it with every best of intention. They want to find out what does Parkinson's disease mean. You know, I saw the Michael J. Fox show, where I see, you know, Muhammad Ali tremoring when he's talking. But what does Parkinson's disease mean? Well, the internet ain't the place to get the definition, let me just say that, right? But that's where a lot of people go. So then you have to kind of combat that initial diagnosis and try to feed them the right information. So then we've got the early signs of disability, which we talked about. Then we talk about the big stuff. Occupational changes. You know, I can't tell you how many people I have worked with that I've been the guy to say, I know this is not what you had in mind for early retirement. You know, you wanted, you know, when we all picture early retirement, we've got tons of cash in the bank, we're sitting on a beach somewhere having a nice drink with an umbrella. You know, it's not, holy crap, I can't work anymore, how the hell am I going to pay my mortgage? And that's what's happening with people that have Parkinson's disease. So it's important for you to recognize, you know, some of the ways of dealing with those kind of things. And I'll talk a little bit about that. The ability to drive is huge. You know, I drive a lot. And if somebody came to me, and again, I've told a lot, I've been the guy to tell a lot of these people. And it's important that clinicians take that responsibility. Because the spouses aren't going to do it. You know, you're not going to have a wife that's going to tell her husband, now it's time to stop driving. Because for 25 years, all she has done is bitch about his driving. So she has no credibility in his eyes, right? And it's the same way for men, you know, for the reversing roles. Kids aren't going to do it for whatever reason. I mean, if you are a child, it's okay, so say your parent lives in Evansville, and you're a child that lives in Indianapolis, and you're the one that tells your Mom, you're not going to be able to drive anymore. And she says, well, how am I going to get around? You're screwed, buddy, because you're going to have to come up with something, right? You're going to be the one making that trip. Unless you get hooked up with some community resources, right? So from the professional perspective, it's really important that we are the ones to do that. Because then they can go back home and go, that SOB Leo told me I couldn't drive him. I know, he's a stupid idiot, but we got to figure out how to make it work, right? Because then the bad guy's not the family. And I'm here to tell you, in my personal experience, I'm a social worker. I've been a social worker for a long time. I'm supposed to know what the hell I'm doing. My mom did not stop driving until she said, well, you know, the sheriff came to the policeman came to the door and said that I hit these cars in the Costco parking lot yesterday. I was like, oh man, maybe you shouldn't be driving anymore. You know? I'm supposed to know what I'm doing. And that's what it took. It had to come to that end for us to make changes. So it's really critically important that you understand these things, okay, from a professional's perspective, that you may be the person to give this bad news, okay? Then when we talk about this whole thing of other health problems, you know, with Parkinson's disease, people see it as an old man disease. Granted, it's not really an old man disease all the time, but as we get older, and I had this question posed thousands of times, is this my Parkinson's disease or is it because I'm getting old? could be one or both. They could be playing off each other. The fact of the matter is that it's happening. We got to figure out ways to overcome it, right? So then we get into the changes where you need some help, where you need home health, and I have gotten really good over the years at making older ladies cry when I say this statement. I know that you just want to sit there and hold your husband's hand and watch TV, and you just can't do that. That's what happens. Over the years, everything has been so slow and insidious that, the caregiving burden has become so big for that spouse, and their time has slipped away. They no longer can hang out with the ladies from church. They're not in the choir anymore. They're not going to clogging. They're not even sometimes going to church on Sundays because they can't leave their spouse. And that is huge. It takes 2 hours to bathe their spouse. You guys in the home care industry know this, right? That's my first intervention. My first suggestion for home care is you need to get somebody in there to help you bathe your loved one. Bigger or smaller than you, it doesn't matter. It's hard to bathe someone that's soapy and wet in the first place, but when you throw in the fact that they're having balance and strength problems, or their body's moving on its own, and you can't do anything about it, that causes a lot of problems for this caregiver. And I've told caregivers time and time again, what happens if you go down? What happens if you fall when you're trying to give care to your loved one? Then you're both screwed and you have no options. Talking about this stuff beforehand gives everyone options. It just does. And then, the big one about nursing home care, out-of-home placement. And, everybody uses the phrase, I put him in a nursing home. Well, I'm here to tell you that when my mother left her apartment, she moved into a nursing home. She needed the 24-hour daycare. My sister and I were not capable of doing that. We knew that we needed 24-hour day assistance with her. There's a reason why home health agencies and why nursing home folks come to work in shifts and they're not there 24 hours a day. Caregivers at home don't have that luxury. They're there 24 hours a day. So these are the kind of things that are important to recognize. And then talking about palliative care and hospice. So one of the things that we've come up with, one of the resources that we've developed in our agency is, for 20 years I've been working in neurology. 20 years I've been giving out the cards to say, I have Huntington's disease, or I have Parkinson's disease, or I have ALS. Never did I even think about what happens when a caregiver goes down. What happens if a caregiver has an accident, right? So I'm going to pass these cards out. You guys are welcome to take one. I don't have tons of them, so I will trust that you only take one. So what does happen? So we developed these cards. I have a facilitator in Muncie at one of our support groups that came up with this idea. And the wording of the card was actually done by the son of one of my patients at the VA clinic. Because we had it too passive. He's like, that's not forceful enough. We need something more forceful. So that's where this came from. And you guys are welcome to take those. You guys are welcome to copy them or whatever. So now let's get down to getting some resources. Does anybody have any questions? Personally? Have I stimulated questions in my ramblings? Okay. Is she more interesting than me so far? Okay, good. That's good. And everyone's still awake after lunch. That's critically important. Thank you, man. Thank you. Okay. So, I have kind of carved out this little niche for myself to become kind of the resource guy. And I'm not the guy that has all the answers for exactly where you should go, exactly what agency to contact. But I'm the guy that's going to give you some general guidelines. Like I tell people, I can get you a couple of more steps down the path. Call these people and they can help you. The one thing that is critically important when you're working with somebody, regardless of where they are in the diagnosis, it's critical that you don't overwhelm them with stuff to do. Everybody's got their books of resources. Everybody has their what to do, and it's like 15 different steps. And so the next time you meet with them a month later, so how are you doing on that stuff? I didn't do anything, right? Because there's just too much to do. the goal of anyone working with someone that has a neurological disease or just about any other diagnosis is to help folks to be. Where can we best do step one? What do we need to do? What do we need to just make a list of the issues and start figuring out what's priority one? And then go from there. With a lot of people in the earlier stages of diagnosis, it's financial stuff. Okay, so where do we need to go? Where do we need to be directed? Some people, they just need some support. They need to know that they're not the only people out there. So, what I've done on this slide is I've gotten a whole array of different resources. So, the Parkinson Awareness Support Association of the Tri-State Area. Does anybody know that that organization exists? Do you know that they put on a barbecue the past 2 or 3 years to raise money, and they've had bands come in and all that? Yeah, so it's important for you guys to know that. Right? It's important for you guys to know that they exist, that they are out there. Parkinson Awareness Association of Central Indiana. I was on their board of directors for many years. They are a clearinghouse of information. You don't have to be in Indianapolis to get information from them. They've got people all over the state that participate in their mailing lists. On their website, they have a list of support groups all throughout the state. So regardless of where you're working with, they can direct you. Firefighters with Parkinson's disease. Firefighters have an increased risk for Parkinson's disease. And they don't really know why that is. So there's a gentleman in Indianapolis, Gary Coons, who is a firefighter. He was the former director of public safety for Indianapolis. He's now the director of Homeland Security for Indianapolis. He was a firefighter, and he developed Parkinson's disease. He thought, well, this is kind of weird, you know? I'm not a farmer. I wasn't drinking groundwater that was contaminated with fertilizer. I've never worked in a steel mill or as a welder or anything. Why is this happening? So he's working with a toxicologist at IU Bloomington. Because, you know, everything in this room is in a state right now that is pretty, you know, it's pretty innocuous. It's not causing us any problems. When we start setting stuff on fire, then what's coming off of it, right? And while the firefighters are in the fire, they've got all their masks and everything going on. But what happens when they take their masks off and they're in the truck with all these suits that reek? They have all these toxins oozing out, right? So Gary started this organization, Firefighters with Parkinson's disease. So if you're working with people that are firefighters or other public safety people, they can get involved in that group. They can be amongst their kin. And so for young people, there are a lot of young people in the state of Indiana that get diagnosed with Parkinson's disease. The Young Parkinson's Group of Indiana, I was on their board of directors for a long time too. They make it normal to be 45 and to have to retire because of Parkinson's disease. Because let me tell you, there are a lot of people that are in that situation here. A lot of people. And from the caregiver's perspectives, just knowing that there are other support groups out there. For real, true information, we've got the Parkinson's Action Network for the political stuff. We've got APDA, Parkinson's Disease Foundation, and National Parkinson Foundation. If you have a new patient and they want to go to the internet to find stuff, that's where they need to go. Or to the IU Health website. IU Health was designated as a center for care for the National Parkinson Foundation. I did a lot of work with the National Parkinson Foundation in establishing that designation for 12 clinics throughout the country. And it's grown and grown and grown since then. So these are the places where to get that expert advice. Okay? And there's the Parkinson Support Center for Kentuckiana is huge. They've got all kinds of resources. And just walking around and talking to the vendors here yesterday, I was able to really develop a lot more resources. You know, if you have somebody that's looking to get, you know, a Medicare plan, and they need some help on the direction of how to do that, or a Medicare supplement, you know, those folks over at St. Mary's will do it for free, and they really know what's going on, right? In addition to SHIP and all those other things. So there's a lot of stuff out there. So now, what else can we use for resources? Quality of life stuff. This is Dr. Jessica Huber with a really cheeseball smile. And she is a professor at Purdue University. So Jessica came up with this idea that, you know, one of the things that people have problems with Parkinson's disease is their voice gets smaller, right? So they have to use a microphone to magnify like that lady next door. So she thought, what can we do to try to help people get their voice larger when they're talking? She said, I know, we'll create white noise in their ear and see if that works. So her first prototype that she did clinical trials with had almost like a headphone on one ear, and then it had a thing that went around your neck, and it had a sensor right here. So when your vocal cords started moving, then it would set off this white noise, right? So it went from all that to that just looks like a big hearing aid, doesn't it? So that thing is now commercially available, which is just amazing. A lot of my former patients were in the clinical trial to develop that little thing. And it senses when you start talking, and it creates white noise. Why does it do that? So you talk louder, you talk over the white noise. So your spouse can hear you. You know? So one of the things I would talk to people about all the time, especially older folks that have been married for a long time, you know, when, for instance, if the husband had Parkinson's disease, the wife would be complaining, you know, I can never hear him, he's yelling at me from the other room, and I can never hear him. I'm like, well, is that a marriage thing, or is that a Parkinson's thing? Because it could be both. So this device helps to overcome at least one of them. Okay? Some nutrition interventions. And I am officially no longer able to call this Tom's Poop cereal because he got pissed off because I called it that once. But I had a patient that recommended this stuff. I mean, it's got like oat bran, it's got, and I'm not endorsing this particular product, but it's important when you look at interventions, rather than just going right to the medicine. There are a lot of people that don't want medicine. We'll just give you some stuff that'll, you know, with some flaxseed, that'll clean everything out, right? And then this walker and this cane are pretty cool. So these are developed from a company in Skokie, Illinois. The walker, it weighs about, I'm not lying, about 10 times more than a regular rollator walker. In order to make it go, you have to pull the handles up. They're not brakes, they're releases of the brakes. So people with neurological diseases, when they're trying to walk, they've got a nice, stable walker in front of them that's not going to go anywhere. Because you know those rollators you know, if you bend over on them, they're gone. Well, this, you just have to release the thing and you're stopped. The cool thing about that, see this laser line right there, the red line in front of the cane? So people with Parkinson's disease freezing, I have a very good friend of mine who had to retire from his Parkinson's disease when he was 46. He's a few years older than me, and he had really bad freezing. And one of the things that the brain does is really pretty remarkable, because we had a different patient that couldn't get out of his car, but he could climb mountains. Because the brain, the routing of the brain stuff is just a different pathway. So anyway, so Tom had problems, and he was almost falling over every time he tried to walk. So I was like, dude, just test drive this cane and see what you think. So you press the cane down, and it puts a red line in front of your feet. The red line tells your brain, oh, I gotta go. Boom, 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 boom. You overcame his freezing. The walker does the same thing. It puts a red beam down. And the walker also has a cueing thing where it will give you an audible sound for when you need to move. It's pretty awesome. These little things, so the walker and the cane, insurance will pay for both of them, but they won't pay for the $250 it costs for the cueing. They'll pay the $600 for the walker. Right? So it's $250 out of pocket to get this really badass walker, which is not good for everybody, because if you have an elderly spouse, you can't lift that thing into a car. There's no way. But at home, it's fantastic. It's really, truly fantastic. Also, a program that I work with the Parkinson Awareness Association of Central Indiana, is we developed this PACES Cares program. We had somebody donated some money for us, and we developed a respite care program, whereas the families would contact the organization, they'd fill out a really quick application, and then they'd be able to get up to X number of dollars for respite care for a weekend or for so many hours a day or whatever. So these things are out there, not just with PACE, not just with the Parkinson Awareness Association, but some other organizations as well, have these opportunities out there for you, okay? All kinds of exercise programs, right? Has anybody ever heard of Rocksteady Boxing? Rocksteady Boxing is the single most badass thing you will ever see in your life. People that cannot walk, people that cannot get out of their cars are boxing. It is truly amazing. They're building strength. They're building balance. They're building some sort of stamina in their lives because of this boxing program. So Dave's a really good guy. He's had Parkinson's disease for probably 10 years. And this is how he walks. But when he gets the glove strapped on, and he gets in front of a speed bag, or a heavy bag, at least he's in front of him now, he can do it. It's a non-contact boxing, by the way. Non-contact. Dancing is huge. Because again, what happens in people's brains is that things go into different pathways. So there are a lot of people that can run with their Parkinson's disease, but they can't walk. Literally. They can dance, but they can't walk. So how does that play into it? Well, maybe it's a matter of getting them a walking pattern that's different than what they used to walk. So they're still able to walk. Maybe put a beat in their head, have some music going, and so that will help them to walk. Reducing their falls, giving them some independence, right? So there's dance classes. There's Delay the Disease. David Zitt, a guy from Ohio, had a friend of his that got diagnosed with Parkinson's disease, and David had this physical therapy company he was working. He had organized, and so he's over the years developed this Delay the Disease program. It's available on video. It's available in book form to be able to help people to do simple exercises. Simple exercises with a chair that's going to not cause them to fall, but it's going to give them some strength. It's going to give them some confidence to do things. Okay? Tai Chi. Tai Chi is huge in the Parkinson's community. Huge, huge, huge. And then this crazy spinning thing. It's like bicycling on steroids kind of stuff. Where you're like, how the hell is anybody doing that? But they're, I don't really. I know some of you probably do it. And you're thinking that I'm an idiot. That's fine. But I just can't wrap my head around it. But with Parkinson's disease, they've shown that forced, rigorous exercise is more beneficial than just simple, non-sweaty exercises, for lack of a better term. So the more intense and rigorous. So if somebody's going to try to exercise because of their Parkinson's disease, they're much better to do the spinning than they are to do regular bicycling. They're much better to do the boxing than they are some less rigorous exercises, if it's safe for them. So I'm bringing up these ideas because if there's nothing like this in your community, there are opportunities to bring these here. Whether it's buying a video from Delay the Disease, whether it's going to Indianapolis and getting certified as a trainer for Rock City Boxing, and then coming back to your community and starting a boxing program, whether it's consulting with Dance for Parkinson's or the Tai Chi programs, or working with your YMCA or your local athletic program to do a spinning class, all these things they don't just improve the individual physically. Rock City Boxing is one of the best support systems ever. Because first of all, the perception is it's a pretty cool thing. Right? It's pretty badass to be a boxer when you're 70 and have Parkinson's disease. Or when you're 86. We have a lady that is 93, and she's a boxer in Rock City. She's the most badass little Jewish lady you will ever meet in your life. B is awesome. But it brings together a community. It's not like you're going to Golden Sandals or whatever those things are called. You're going to boxing. Come and see Grandpa goes do some boxing. And because of that, it really develops a strong community. They are there to support and trash talk each other all at the same time. It's really, truly amazing. And that can happen in all these other things. So, when you look at support groups, I had a support group once. It was a gentleman who had Huntington's disease and could no longer work. He was a truck driver and couldn't work. Another guy whose father-in-law had Huntington's disease, so his wife is at risk for the disease. And another guy who himself was at risk of possibly having Huntington's, right? Because his mom had it. And we painted one of the guys' living rooms. That's a strange support group, isn't it? But these are guys that wouldn't sit around in a circle and talk about their feelings. But we had a hell of a great time painting that living room. And things came up and questions got answered. And then we hung drywall in one of the other guys' basements. Because it was just a means of getting them engaged in something. And for whatever reason, the trend now is, a lot of the support groups that I've worked with in the past, for whatever disease state, they're kind of waning a little bit. The attendance is kind of off. So what can we do to kind of change things, kind of infuse those things? And these are resources that you can look to in your own community, in your own service provider, if you've got an office for your home health agency, maybe you can have an exercise class once a week or something. You just never know. Or have an art therapy class or something, or music therapy. And bring in not just the people who are affected, but their families as well, to be able to do that. So one of the things, isn't that awesome? So this is my wife's daughter. A couple years ago, noticed the pink and the red gloves. We had an open house at Rocksteady. The first thing she did was grab the gloves. It's awesome. So anyway, so there's this lady. So the biggest thing that I do is I know where I don't know things for the most part. I know where I try to recognize when I am not the expert. Who do I need to get involved with helping to do some things? So where can we go in this community to be able to get help? Right? So if you're in this catchment area, Swerka is a great place to start. Those people are the experts on what's available in the community. You can find, if you have questions, talk to them. If they don't know, they'll send you to somebody else. It might take you a couple of steps, but if you can do a couple of steps and then pass that on to the family or the caregiver or the person who's affected, then he or she can take that from there. Rather than they make 3 phone calls and they're like, none of these people do anything, right? Or they call you. I have been put on a pedestal so many times for things that I had nothing to do with, which I openly acknowledge to folks. I'm like, I didn't do that, somebody else did. Like the caregiver card, Michelle did that, I didn't do that. But it was just because I sent them in the right direction. And that's all people need. Again, it's focusing the beam. When people need help, my mom's not cooking and she's not eating anymore. What do I need to do? Well, let's focus the beam. Okay, so there are a couple of different things you can try. The local area agency on aging. Do they have a food program? Is there a local church that has a food program? Can you and your siblings chip in and one of you takes each day and drops some food off to them? Whatever it is, it's just a matter of trying to focus that beam in. So, transportation is a huge thing. Partnering with your area agency on aging, wherever you are, they usually have transportation programs where they can hook you up with transportation programs. Senior centers have really great transportation programs as well. And this plays right back into that when you have to talk to somebody about stopping driving. Whenever I talk to somebody about they have to stop driving, I always have an alternative in my back pocket that I'm telling them. And one of the big things is, especially for women that I talk to, I'm like, you know what? Here's what you do. Figure out how much it's costing you to drive each month. Car payment, insurance, gasoline, repairs, whatever. Figure out how much money that is. And then once a month or once every couple of weeks, rent a limo and take your girlfriends out and you guys just have a girls' day. Right? It's huge. You're giving them permission to do something else. You're giving them an alternative. And start easy, start simple. The transportation thing is so huge, getting people their independence. So my buddy Tom, he and I like to play bat golf occasionally. And it used to be, I would say, hey Tom, I'll meet you at the course at such and such time. But now, and over the past couple of years, it's been, hey, I'll just pick you up at such and such a time. It's not, it's not like I'm going to say I'm going to meet him at the course, and then he has to figure out how to get there. No, you just change things around. You just do that slowly. Slowly but surely, you have the other spouse that just goes to the driver's seat automatically, instead of the one that's not going to be driving for much longer. And it's kind of unspoken. It's non-threatening. It just happens, right? And hopefully that will work. It doesn't always work. I had to call at the request of this guy's wife. I called the local police department. I called their insurance company and said, this guy has been told by his physician not to drive, and his wife asked me to call you to tell you this. Right? It's not really what I wanted to do. But a year after that, this guy was a woodworker who gave me this whole thing with a Bible quote that said, even though you told me I couldn't drive anymore, I wanted to give this to you. So I think that he recognized himself that it was a problem, but he just, stubborn pride takes control sometimes. Okay. Anyway, so this is a whole representative. The National Elder Law Association is huge. For people that are trying to get Medicaid, people that are looking at financial planning, A specialist in elder law is amazing. I'm just here to tell you. I know that everybody seems to have an attorney in their family somewhere. Everybody has an attorney that's going to be able to take care of something, but it has been invaluable in my practice for folks to find an elder law attorney that they can talk to and really get the direction. Okay? For a lot of these diagnoses, okay, so if you were in Vietnam, in the arena in Vietnam, exposed to Agent Orange, and at any time in your life after that you get Parkinson's disease, did you know that is service-related? If Parkinson's disease is considered service-related, you can get 100% of benefits, 100% disability benefits from the Veterans Administration. It's huge. Huge, huge, huge. But if you didn't know that, then you wouldn't know to refer people to the VA or the paralyzed veterans who are married to be able to go down those pathways. So all these are just community partners. Now, why do I have a picture of an island? I have a picture of an island because I'll tell you a little bit of a side story. So I know that's all I've been doing is telling side stories, but you obviously no one's falling asleep yet, so this is good. I did a presentation to a group of caregivers for Parkinson's disease. This has been just a couple of months ago. And I just had 3 topics on the screen. I had a whole presentation. I had 3 topics on the screen. Caregiver issues, employment, and insurance, right? That was the only slide I showed for the entire hour and a half I spoke because of the questions. So this woman raised her hand and said, what do you have about caregiver issues? And if you tell me I need to take care of myself, I'm going to punch you in the face. This was obviously Rock City Boxing, and her husband was a boxer. That's probably why it came from. But how many times do we tell caregivers, you need to take care of yourself? Right? But we don't tell them what the hell to do. Right? We don't give them any idea of what that means. So what I tell people, and what I've told people for years, is you need to find your island. When was the last time you were at your island? I had a guy, he and his wife bought a house on a golf course 40 years earlier. He used to play golf every single day. His wife had Parkinson's disease, coming to the clinic like their second or third visit. And I said, hey, so when's the last time you played golf? Could not remember the last time he played golf. Golf was his island. He was noticeably agitated, wasn't getting any sleep. He just felt like he had to be the only caregiver for his wife, right? Whatever your island is, we all have our islands, right? Whatever it is. If it's, driving way too fast on I-64 with the radio cranked way up, if it's, just isolating yourself and watching one of these Netflix series from start to finish where you just, oh my God, it's Saturday already. Whatever it is, we all have our islands. It's critically important that you help people to find their islands before they get to the point of just complete frustration. When they're talking about physically harming their loved one that has whatever condition, and they probably should have been in their island a while back. That's why it's up there. Helping people to find their island is critical. Okay? So, this caregiver prayer I have had in my pocket for a long time. As I stumble through this life, help me to create more laughter than tears, dispense more happiness than gloom, spread more cheer than despair. Never let me become so indifferent that I will fail to see the wonder in the eyes of a child or the twinkle in the eyes of the aged. Never let me forget that my total effort is to cheer people, make them happy, and forget, at least for a moment, all the unpleasant things in their lives. And in my final moment, may I hear you whisper, when you made my people smile, you made me smile. I think that's why we're in the caring business, right? Because we want to have an impact on people's lives. We want to make a difference. And so I hope this was helpful. I know I didn't give you this is where you need to go, here's a list of stuff, but I hope I stimulated some ideas for it. Yes?
Yesterday there was a breakout session on that, it's called Songshine. Have you heard of that?
No, I've not.
It's for Parkinson's people with
Oh,
swallowing.
the singing stuff?
Sing Songshine. I think it's Songshine, but it's starting September 16th at the Alder's Gate Church or something. It's a whole group of volunteers and people that get that voice out.
Right. It's a means of getting people's voices louder.
Yeah.
The singing for Parkinson's is big too. There's a big singing group, a big famous singing group in Florida. Oh, that was a most excellent segue. So let me see. So there's a woman who, and we'll test this guy's speakers and see how good they are. So this song was written and performed by a woman with Parkinson's disease. And he said it would be loud enough in this room. Can you hear that? It really does have great tone quality, I know. Hopefully you can hear the lyrics.
My life, it don't count for nothing. When I look at this world, I feel so small. My life is only a season, a passing September no one will recall. But I gave joy to my mother, and I made my lover smile. I can give comfort to my friends when they're hurting. I can make it seem better for a while. My life is half the way traveled, and still I have not found my way out of this night. My life is tangled in wishes, so many things that just never turned out right. But I gave joy to my mother, and I made my lover smile. I can give comfort to my friends when they're hurting. I can make it seem better. I can make it seem better for a while.
I just absolutely love that song. And, knowing it came from a woman with Parkinson's disease, and, I'm sure that it describes a lot of the struggles that she's had in her life. It's just, I just love it. It's called My Life, and it's by Grace Griffith. So, thank you all for being here.